It is time to get back to work following the shutdown due to the presence of coronavirus. All employers need to consider how best to decrease the spread of COVID-19 and lower the impact in your own workplace. This episode will include a short overview of things to consider when getting workers back to the workplace when we come right back.
Welcome to this episode of Workplace Health, Improving Employee Health and Productivity, with President of Workplace Health, Inc., Shauna Dunbar.
As most of you know, I am a public health nurse. While most nurses affect the health of one individual at a time, public health nurses impact the health of entire populations. And I am an occupational health nurse, so my population is from hire to retire, those of us in the working population. So needless to say, the COVID crisis has impacted most of my clients. Not all employers decided to shut down during the crisis, but most did have to alter the physical environment as well as modify some policies and procedures. So what do you need to consider as workers are returning back to the workplace? The activities should fall into one of three categories. 1, prevent and reduce transmission among employees. 2, maintain healthy business operations. And 3, maintain a healthy work environment. So let's unpack each of these. When we want to prevent and reduce the spread of any disease in the workplace, the most important thing is to encourage sick employees to stay home. And this needs to be reiterated by management. Often I find workers feel that they will get in trouble by taking time away from work. We do not need those germs in the workplace. A policy clearly outlining expectations for illness and having a written sick leave policy will go a long way in preventing the spread of any communicable disease amongst the coworkers. Some of my clients are also conducting daily health checks. This can be done in a person or even by way of employee self-monitoring and indicating on a checklist as they come into work. The idea is to be sure someone that is having symptoms does not come into the workplace. Just remember, whatever you decide, please be aware of medical privacy and of course be respectful. Another way to be ready to have employees return to the workplace and reduce disease transmission, again, this is true for any communicable disease, is to conduct a thorough hazard assessment. For example, is there an area where transmission is more likely to occur? Most businesses will highlight the cafeteria or the bathrooms. And be sure there are reminder signs for hand hygiene. And it's a great idea to place a waste paper basket by the door so employees can use their paper towel to open the door and then dispose of it. We also know that the CDC is recommending wearing a cloth face covering as a way to contain the wearer's respiratory droplets and help protect the coworkers and members of the general public. Just remember that wearing a cloth face covering does not replace the need to practice social distancing. Also, educate employees about steps they can take to protect themselves at work and at home. This has been well advertised in the media, and it is true for the workplace. Encourage your employees to wash their hands, often with soap and water for at least 20 seconds, or they can use hand sanitizer if soap and water are not available. Avoid touching their eyes, nose, mouth with unwashed hands. Hand washing is the key. Cover their mouth and nose with a tissue when they cough or sneeze, or use the inside of the elbow, not your hand as a cover. Practice routine cleaning and disinfection of frequently touched objects and surfaces, such as workstations, keyboards, telephones, handrails, doorknobs. You get the idea. Avoid using other employees' workstations. Shared workstations should be kept at a minimum. Signs, again, reminding employees of these simple prevention strategies can go a long way to protecting the workforce. The second set of activities is to maintain healthy business operations. As you know from previous episodes in emergency planning for unexpected events, maintaining your business following any kind of natural or unplanned disaster is imperative. I am recommending the following to all of my clients as they return employees to the workplace. Appoint a workplace coordinator. 2, review your sick leave policies and see where you can be flexible in terms of allowing absences for illness. Also, you should address when it is considered safe for an employee to return to work following an illness. You might want to ask your occupational health professional to help you with this item. When you are making adjustments to any of your policies and procedures, be sure to clearly and frequently, via many channels, communicate so that the word gets out to all workers. It is also suggested to think about how you will maintain business operations should you have a spike in absences. We know in public health that pandemics happen in about a 10-year cycle. So even if we do not see a spike with coronavirus in the future, we should have a tabletop discussion for emergency planning. Make sure you have clear policies about social distancing at 6 feet. The theory here is that because COVID spreads through respiratory droplets, just like any other flu virus, keeping distance while interacting with others will reduce the likelihood of transmission. Remember, disease is spread through close and prolonged contact, not casual contact. In other words, just walking past a coworker is not likely to transmit the disease, but working closely together for a long period of time might. Cloth face coverings, as we mentioned, will also contain the spread. Last, we will talk about ways to maintain a healthy work environment. First and foremost, please consider your work environment and ventilation. The latest data indicates the spread of the virus was mostly seen in workplaces that are kept cold and dry, like meat packing plants. The spread is almost nil out of doors. So check to see that there is proper ventilation and room temperature is set above 65 degrees. Just as we encourage during flu season, be sure to have ample supplies of hand hygiene stations throughout your work environment. Make the healthy choice the easy choice for employees to clean their hands frequently. Finally, perform routine cleaning and disinfecting. Most businesses are adding an extra layer of disinfecting, especially shared work surfaces, with their housekeeping staff to minimize the risk of transmission. Well, there you have it. Some ways to ensure you open your workplace back up to all workers. For more information about how you can be best prepared to open your doors, please do not hesitate to contact our office. We're offering free phone consultations on this very important topic. Now go make it a great day.
Thank you for watching Workplace Health. For more great information, visit www.workplacehealthinc.com.